In a world where invisible battles range within the human body, there is a silent adversary that plagues thousands of lives: sickle cell anemia. This insidious genetic blood disorder, passed down from generation to generation, transforms the lives of those it touches. These misshapen blood cells, when exposed to low oxygen levels or under stress, become rigid and clumped together, obstructing blood flow and causing excruciating pain. This phenomenon, known as vaso-occlusive crisis, can strike suddenly, immobilizing individuals and compromising their overall well-being. However, medical advancements have paved the way for several medications that offer relief and hope to those living with sickle cell anemia. In this video, we will explore the top 10 medications that have made a significant impact in the lives of patients across the nation. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Hydroxyurea. Hydroxyurea, the superstar of sickle cell anemia treatment, struts onto the medical stage, making a grand entrance worthy of a Hollywood blockbuster. With FDA approval in its back pocket since 1998, this medication knows how to make an impression. But what's the secret behind hydroxyurea's fame? Well, it's got a trick up its sleeve: stimulating the production of fatal hemoglobin. The superhero version of hemoglobin thus swoops in and saves the day. How? By preventing those pesky red blood cells from morphing into mischievous sickle-shaped troublemakers. L-glutamine. So there is this natural occurring amino acid called L-glutamine that has caught the attention of researchers and doctors when it comes to treating sickle cell anemia. It's pretty fascinating. They've developed a pharmaceutical-grade version of L-glutamine called Indari, and it actually got the stamp of approval from the FDA back in 2017. Now here's why it's so exciting. Indari has shown some promising results in reducing the frequency of those acute complications that often plague individuals with sickle cell anemia. How does it do that? Well, L-glutamine is like a special kind of fuel for red blood cells. By increasing the availability of glutamine, Indari helps those cells function better and stay healthy. Crizanlizumab. Now what crizanlizumab does is pretty remarkable. It focuses on the adhesion or sticking of the sickle cells to the walls of blood vessels. You see, in sickle cell disease, these misshapen red blood cells have a tendency to clump together and get stuck in those blood vessels, causing a whole lot of trouble. It's like a traffic jam inside your body, and it can be extremely painful. But here comes crizanlizumab, also known as Adakview, to the rescue. By specifically targeting and blocking this adhesion process, this medication helps prevent those vaso-occlusive crises, which are those painful episodes where blood flows gets blocked and organs and tissues don't get enough oxygen. Can you imagine the relief this brings to patients? It's like a breath of fresh air, or rather a breath of unobstructed oxygen-rich blood flow. Luspatercept. In 2019, there was a groundbreaking development in the field of sickle cell anemia treatment. A medication called Reblozyl received approval from the FDA, making it the first ever medication specifically approved to treat anemia caused by beta thalassemia, which is often seen in conjunction with sickle cell anemia. Now let's talk about what this medication actually does. Reblozyl, also known as luspatercept, works by stimulating the production of red blood cells in the body. This is pretty important because one of the major challenges that people with sickle cell anemia face is chronic anemia, which means they have low levels of healthy red blood cells. And when your red blood cells are low, you can feel tired, weak, and lacking energy. Voxelotor. So how does voxelotor work its magic? Well, it tackles one of the main issues in sickle cell anemia: the polymerization of sickle hemoglobin. You see, in this condition, the hemoglobin protein in the red blood cells becomes all clumpy and sticky, causing those characteristic sickle shapes. It's like the cells are trying to navigate through a narrow maze leading to all sorts of problems. But here comes Voxelotor to the rescue. This medication has the ability to prevent that polymerization process from happening. By doing so, it allows the red blood cells to maintain their flexibility and move around smoothly. And guess what? When the cells can flow freely, oxygen delivery throughout the body improves, which is crucial for overall health and well-being. Nikasan. It's fascinating how sometimes unconventional solutions can make a real difference in managing a complex condition like sickle cell anemia. Take Nikasan for example. Although it hasn't received official approval from the FDA in the United States, it has made quite an impact on the global management of sickle cell anemia. So what exactly is Nikasan? Well, it's an herbal preparation that was developed in Nigeria. What makes it unique is that it's derived from indigenous plants, harnessing the power of traditional medicine. Now, I know what you might be thinking. How can plants help with a serious medical condition? But bear with me because there's actually some pretty compelling evidence. Penicillin. Penicillin is a tried and true antibiotic that has been around for ages. And let me tell you, it has made a world of difference for individuals with sickle cell anemia. Because they're more susceptible to infections, many patients start receiving preventive penicillin treatment from a young age. It's like a shield against potential infections that could wreak havoc on their already compromised immune systems. What's so amazing about penicillin is that it's simple yet incredibly effective. It fights off those nasty bacteria and keeps infections at bay. Think about it, by taking this relatively straightforward medication, countless lives have been saved, and burden of illness has been significantly reduced for individuals with sickle cell anemia. Pain medications. Given the chronic pain associated with sickle cell anemia, pain management is of utmost importance. Non-opioid and opioid medications such as non-steroidal anti-inflammatory drugs or NSAIDs, acetaminophen, and opioids are commonly used to alleviate pain in sickle cell anemia patients. NSAIDs like ibuprofen and naproxen sodium help reduce inflammation and provide relief from mild to moderate pain. Blood transfusions. Blood transfusions have long been a cornerstone of sickle cell anemia treatment. By replacing sickle-shaped red blood cells with healthy ones, transfusions can help alleviate anemia, improve oxygen delivery, and reduce the risk of complications. Transfusions are often used in cases of severe anemia, acute chest syndrome, or to prevent strokes in high-risk patients. They provide a lifeline for many individuals with sickle cell anemia, offering immediate relief and the potential for long-term health benefits. Stem cell transplantation. Stem cell transplantation, also known as bone marrow transplant, is a potentially curative treatment for sickle cell anemia. This procedure involves replacing the patient's faulty bone marrow with healthy stem cells from a compatible donor. But the story of sickle cell anemia is not solely defined by its clinical aspects. It is a narrative of strength, resilience, and community. Patients, families, and advocacy groups have united to raise awareness, push through research funding, and support one another through the highs and lows of this relentless battle. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well informed and taking care of yourself. If you enjoy watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.